The Health Minister says he can't guarantee patients will be in the new Royal Adelaide Hospital by November. His admission coming amid news the builders may need an extra 2 months to have the $2 billion hospital ready to hand over.
From the outside, the new Royal Adelaide Hospital is taking shape. But according to the government's own independent advice, SA Health may not collect the keys from builders in April as promised.
There was some concern that there may be a possibility of a couple of weeks late. The subsequent advice to that from TBH is they are more concerned now that it will be a longer period, more in the line of a couple of months.
And with an autumn handover now in doubt, the Health Minister is expecting but not guaranteeing patients will move in on November 30.
What I'm not going to do is make the mistake that the Queensland Conservative government did, where they tried to force an early opening of the hospital before the hospital was ready.
Medical professionals say if handover happens 2 months later, when doors open will be impacted.
You wouldn't want to rush the job, and I would envisage that that would mean a further delay in the opening of the new RAH into 2017.
Calls too for builders to pay taxpayers separate penalty payments if the April deadline is missed, on top of missing out on repayments from the government.
That is a sufficient penalty. That is what the normal penalties would be.
The whole reason for PPPs has been, hey, we the private sector can build these projects on time and on budget and do it better than the public sector. And if they're going to make that particular claim, then contractually there should be penalty provisions in there.
There also remains the prospect of the building consortium lodging another potentially costly compensation claim against the state government if further soil contamination is found on the site. Rory McLaren, 9 News.